Good afternoon, Chairman Klein, Representative Scott, and esteemed committee members. My name is Lynn Newberry. I am a nurse administrator in a community-based hospital and a student of the doctoral program at Old Dominion University. Today you will hear from 5 of my colleagues who work in a variety of healthcare settings across the healthcare continuum. We are in support of House Bill 4266, Nurse and Healthcare Work Protection Act. We support this bill and ask that you consider our firsthand experience and evidence to assist you in your vote. Thank you.
Good afternoon, honorable senators and distinguished committee members. My name is Amanda Fulmer and I have over 10 years of experience in the nursing field. As a former labor and delivery nurse and a current women's health nurse care practitioner, I have witnessed countless work-related musculoskeletal disorders among my colleagues. The purpose of the Nurse and Healthcare Worker Protection Act, also known as H.R. Bill 4266, is to direct the Secretary of Labor to issue an occupational safety and health standard to reduce injuries among patients and healthcare workers. The Center for Disease Control and Prevention defined work-related musculoskeletal disorders as short or long-term injuries to the nerves, tendons, muscles, and the supporting body structures resulting from everyday tasks such as lifting, bending, pushing, pulling, overexertion, or repetitive motion. Healthcare workers perform these tasks every day, caring for your loved ones, friends, and families. Despite the possibility to prevent or reduce exposure to these hazards, musculoskeletal disorders are the leading occupational health problem plaguing our healthcare workforce. In 2014, the Bureau of Labor Statistics ranked registered nurses 6th and nursing assistants 2nd among all occupations for the number of cases of musculoskeletal disorders resulting in days away from work. Musculoskeletal disorders also accounted for 54% of the total non-fatal occupational cases reported by nursing assistants in 2014. Furthermore, nursing assistants had an incidence rate for overexertion, which is the main cause of musculoskeletal disorders, of 204.6 per 10,000. This number is 5 times greater than the number for all workers, regardless of occupation, for this type of injury or exposure. Fortunately, these injuries are preventable. Without approval of H.R. Bill 4266, healthcare workers will continue to get injured, resulting in a decrease in patient safety and an increase in healthcare cost. I strongly urge you to stand with the healthcare professionals and support H.R. Bill 4266. Establishing a universal standard regarding safe patient handling, mobility, and injury prevention for healthcare workers is necessary to protect your loved ones and healthcare workers, as well as increase access to care, address the nursing shortage, and decrease costs. Thank you for your consideration and time.
Good afternoon, Mr. Chairman and esteemed committee members. My name is Vince Mertz and I am a nurse practitioner from Newport News, Virginia. I have been in nursing as a bedside nurse for the last 24 years and most recently working as a nurse practitioner. I am here to discuss the Nurse and Healthcare Workers Protection Act, H.R. 4266. As a male nurse, there is always the expectation that I would be the one to help move the heavier patient because I am stronger than the female nurses. Unfortunately, several years ago, while trying to assist a 300-pound patient to the bedside chair, I suffered a debilitating injury to my lower back. I was out of work for 2 weeks and only could return to light duty doing a desk job. Fortunately, I was able to return to the bedside nursing, but that was only after being out for 6 months. This could have been a preventable injury if technology and lift equipment as described in H.R. 4266 were in place. Let me review a few startling facts. Currently, less than 10% of nurses are men and most do not work at the bedside. The average age of the nurse, both men and women, is approximately 48 years old. According to the Bureau of Labor Statistics Employment Projections 2012 to 2022, there will be a need for 525,000 replacement nurses in the workforce, bringing the total number of job openings for nurses due to growth and replacement to 1.05 million by 2022. Additionally, it is predicted that 50% of the United States population will be obese with a body mass index greater than 30% by 2030. As you can see, these shocking statistics reveal several issues to take in mind when considering H.R. 4266. Number 1, a gender gap, noting that there are not enough men to do the lifting. And as the bedside nurses ages, they will not be as strong as they were when they were younger and not be able to do the heavy lifting. Additionally, a shortfall of nurses, meaning fewer nurses at the bedside, means more lifting for those that are left. And finally, half of the population will be obese. We need to do our part to ensure quality health care by protecting the current and future nurses from work-related injuries. Healthy People 2020's goal under occupational and safety is to promote health and safety of people through prevention and early detection. This is exactly the direction that HR 4266 will take. For these stated reasons, I strongly encourage you to pass HR 4266. Thank you for your time.
Distinguished Congressman, my name is Kathleen Ray. I'm a clinical nurse specialist in adult health, and I work with patients who are in the hospital. I am here today in support of Nurse and Healthcare Worker Protection Act. I urge you to appreciate the perspective of our patients. My colleagues have described the perspective of some providers, and I would really like to share with you the impact that this legislation may have not only on protecting the nurse, but also, and most importantly, on protecting the patient. An example comes from my work with a patient last week. Today I'll call him Mr. Smith. He has colon cancer and had experienced a very significant operation to remove a tumor. On his second day after surgery, he called and asked his nurse for help to go to the bathroom. He needed to move his bowels. The nurse goes in and responds to his need, knowing that Mr. Smith is a morbidly obese patient who has terrible circulation and feeling in his lower extremities. Before surgery, he was not able to walk very well. The nurse is in a position to need to ask for help. She goes into the hallway. Her colleagues are tied up in other important patient care activities. Does she choose between risking Mr. Smith getting up and falling to the floor because he is weak and in pain? Does she choose potentially hurting herself, grabbing Mr. Smith and supporting him in that effort? Or does she compromise his dignity and autonomy by saying, Mr. Smith, I don't have the help that I need to safely get you up. Instead, let me place you on the bedpan. I would like to offer an exhibit today, a video that illustrates how the use of safe patient handling equipment can transform that experience for Mr. Smith and his registered nurse.
So rather than the traditional manual approach of lifting her patient back to bed, we now see how the professional registered nurse is using a supportive sling that goes around the patient's body and a piece of hydraulic lift equipment. This is going to allow the patient to feel stable and secure, and the nurse is going to be able to easily and without injuring themselves lift the patient and return them safely to bed. Our registered nurse is going to demonstrate now for you how comfortable and supportive it is for the patient, also reducing the risk that the patient's going to tumble to the floor and knock his head or break an arm, which are really serious complications that patients experience on a regular basis in hospitals when they sustain a fall from injury. The patient has been comfortably stood and is stable and secure. And now the nurse will be able to move the lift to the patient's bedside and safely and easily, without injury to either one of them, move them to bed. Having seen a piece of lift equipment in action, I hope you can appreciate how it is a game changer for Mr. Smith and for that registered nurse. It provides a mechanism for the nurse to safely move Mr. Smith and prevents him from falling, from inadvertently being injured in hospitals. It's important to know that a piece of lift equipment is not a safe handling program. We need comprehensive programs, such as was demonstrated in the Department of Veterans Affairs. We have nurse researchers, Dr. Powell, Cope, and colleagues, who found that programs must include peer education, support for team members to learn how to use the equipment. They have to become coaches to each other. Thank you very much for your attention.
Good afternoon, Chairman Klein, Representative Scott, and distinguished committee members. My name is Sonia Shaw, and I'm a nurse practitioner and a doctoral student at Old Dominion University. It is essential that you pass House Bill 4266 in order to reduce injuries to nurses, healthcare workers, and patients. Occupational injuries and illnesses cost us over $250 billion a year, and nurses have one of the highest number of low back injuries than any other profession, with skilled nursing facilities being at the top 10 industries for musculoskeletal injuries. Approximately 45 to 52% of all nurses have chronic low back pain from lifting patients, but with passing of House Bill 4266, this number could decrease dramatically. Patient handling injuries are responsible for 72% of musculoskeletal injuries and 53% of all workers' compensation costs. The cost claims are 5 times higher than average for people over age 45. This is substantial since most nurses are over age 45. I often see nurses in my practice as patients who have injured themselves from moving and lifting patients. And although these nurses have had the education on proper lifting and moving techniques, and they're actually performing these techniques properly, they still have degenerative disc disease and osteoarthritis just from the chronicity of the constant lifting and moving patients. The reason for these back problems is that nurses must push, pull, and rotate patients in positions where it is nearly impossible to use proper body mechanics. Many of my patients work in nursing homes that are often short-staffed or staffed just enough so that it's difficult for nurses to take time off work. A back injury takes several weeks to heal, and so if half of the nursing staff is off with low back injuries and then they are recuperating, that leaves about half to do the work, which increases the chances of having low back pain even more. Unfortunately, there is no safe way to manually move patients. Every time a nurse moves a patient, he or she incurs micro injuries to their spine, which eventually leads to a major injury. Training alone has not been shown to decrease low back injuries in nurses. Neither has changing institutional policies. However, a multifaceted program such as introduced by House Bill 4266, which includes training, technology, and lift equipment to reduce the number of back injuries to nurses and other healthcare professionals as well as patients, is imperative.
My name is Mary Poquette, and I'm a registered nurse in nursing administration from the great state of Arizona. I, along with my advanced practice nurse colleagues, are honored to stand before you today, Mr. Chairman, and esteemed committee members, to ask for your support to move House Bill 4266 forward to eventually become law. Knowing that nurses continue to be the most trusted profession in our country, we also possess the dubious honor of ranking 6th amongst all occupations for the highest incident rates of musculoskeletal disorder injuries resulting in days away from work directly related to manually lifting patients. As my colleagues have already explained the current state in our country, as early as in 1992, the United Kingdom enacted minimum standards for successful safe patient handling and movement. Then the respected United Kingdom's Royal College of Nursing in 1996 further interpreted these minimum standards and developed actual clinical guidelines for safe patient handling and movement that remains in their nursing practice regimes today. These original standards and clinical guidelines have proven to be so successful for healthcare workers and the patients they care for that Australia, Canada, and other European countries have adopted and surpassed anything we're doing here today to protect our American nurses from such life-altering injuries. If this act were to become law, you have the potential to make a difference in the lives of 2.7 million of the 3.1 million registered nurses working within the nursing profession. Of the 2.7 million nurses working today, along with a projected increase of 16%, or over 500,000 nurses by 2022, not including nurses retiring, which would bring this total to over 1 million, 1.6 million of these nurses are employed in hospitals and face the potential of a lifting injury every shift they work. More specifically, the 12-hour nurse experiences the potential of being injured during any one of the 156 days they are scheduled to work within a calendar year, or 43% of the time. Could you imagine the burden you would experience if you had to face this potential life-altering event every day that you appeared for your congressional work? Despite this, 2.7 million nurses report to work every day. Being respectful of time, I strongly advocate for the favorable passage of this bill. As you ponder my own and my colleagues' words today, I hope it is clearly evident that we can replicate the successful safe patient handling and moving efforts that our international governments and healthcare persons have previously discovered. The passage of this act will keep our nurses safe, will keep our patients safe, and will cut costs by offering a cost-effective alternative by decreasing nurse turnover related to injury. This is a potential savings of $27,000 to $103,000 per nurse without factoring in the quality of life told. So in conclusion, please make this Bill 4266 one of the bills that will receive a roll call vote to move it forward in an affirmative manner so that it eventually lands on our President's desk for signature into law. Thank you for your time and attention today.
We would like to thank you for listening to our testimony today. As you have heard, this legislation is the only national legislation that improves the quality of patient care and protects nurses by addressing safe patient handling and mobility. Not only will it cut costs, it will be able to provide opportunities for nurses to deliver safe, quality patient care. We strongly urge you to vote yes for H.R. 4266. Thank you.